Good morning, everyone, and welcome to the Friday, April 17th Virtual Visits Toolkit webinar. My name is Samantha Peck. I am the Executive Director for Family Councils of Ontario, and it's my pleasure to welcome you to this session and to thank you for your interest in making virtual visits happen in your long-term care home. This morning, we are going to be taking a walk through together of the Virtual Visits Toolkit, which will enable your home to set up video calls between residents and their loved ones during the COVID-19 crisis. Few logistics before we get into the session itself. You may have noticed that you're all muted during the presentation. This is to preserve the audio integrity and ensure that we can all hear each other well. Throughout the session, you'll be able to type any questions or if you have any technical issues into the chat window. And that's in the GoToWebinar panel that you'll see on your screen. The session is being recorded and will be available for later watching. Just before I turn the session over to our presenter, Christopher Bint from Tech Coaches, I'm going to tell you a little bit about how this all came to be. This toolkit for helping your home set up video calls between residents and their families is born of the COVID-19 crisis. Since March 14th, there's been a visitor restriction for long-term care homes, which means that residents and families can't spend time together in person. So the next best option is to use the technology that's available to us. And while this is born of the crisis, we do hope that a toolkit like this and your home's setting up virtual visits will last when everything goes back to the new normal, because we know that families are becoming more distanced geographically, but not socially and not emotionally. So we're hoping that you'll be able to use this toolkit in the future as well, not just through the crisis. But due to the crisis, Family Councils Ontario, the Ontario Association of Residents Councils, and Tech Coaches, we're looking for ways to help families and residents stay in touch, to maintain a social connection in the time of physical distancing. We know that some homes are already doing virtual visits, which is fantastic, but not all. So the goal of this toolkit was to enable every long-term care home, as well as retirement communities, to develop and carry out a virtual visiting program so that every seniors-oriented and long-term care community will be able to allow families and residents to continue to stay in touch. So a virtual visits toolkit was born. As I said, Family Councils of Ontario, the Ontario Association of Residents Councils, and Tech Coaches have worked together to develop and disseminate this amazing toolkit. So on that note, I am going to introduce the speaker for the remainder of this session, Christopher Bint. He is the CEO, Chief Learning Officer, and a technology trainer with Tech Coaches. Chris has been involved in helping older adults and older adult-oriented communities learn about technology and use it well for many, many years. So I am pleased to turn over the session to him. If you'll just give us one moment while we switch the presenter, we'll get right into things.
Hey there, folks. How does that look? Does that have a full screen of my PowerPoint?
Looks good, Chris.
Marvelous. Everybody, thanks so very much for joining us this morning. My name is Chris. Thanks so much for the introduction, Sam. It is my absolute pleasure to be here today. Lots of folks on the call, they don't know who I am, so I do just want to maybe give you a little bit of background as to why I'm playing a role with Tech Coaches to sort of solve this technology conundrum that we're in right now. My background is from the nonprofit sector. In 2008, I started a charity called Elder Technology Assistance Group And for over a decade, I helped teams of volunteers educate seniors free of charge using technologies that were in their lives. So that was whether it be a laptop that they were given, whether it be a brand new iPad that they picked up themselves that they had no idea how to use. We were literally helping people with the entire gamut of possible technology education opportunities. So that's sort of my background. In 2018, I founded Tech Coaches because we wanted to help a lot of other people, not just seniors. We wanted to help organizations learn how to use technology more confidently. We wanted to help people looking for employment using technology to be able to use technology more comfortably. So people that had no LinkedIn profiles and people that weren't comfortable with email etiquette to talk to possible employers. These were all the individuals that we knew needed some assistance with technology. So that's where Tech Coaches came from. So as we go into the material today, I wanted to first thank you very much for being here. The folks that come to trainings like this are some of my favorites because you embody two philosophies that I hold very dear to myself, and that would be a high willingness to learn, which if you didn't want to learn something, then you wouldn't have come here today. So having a high willingness to learn to me is very important, but equally as important is having the willingness to accept change. And I think what we're doing right now, especially across this entire industry of older adult communities, is we're realizing the role that technology is going to be playing as we move forward. And I don't want to say too much about what I've always been saying, but this is a song that I've been really singing for a really long time. Over a decade, I've been talking about the necessity of technology widespread for older adults in all walks of life. And I think right now, this change that we're experiencing is sort of a catalyst to help us get that point across. So there's lots of technology in our future. Thanks very much for being willing to accept that change. Speaking of change, I just wanted to highlight a couple of ideas to get us all on the same page before we get started. And I wanted everybody just to think about what you would deem normal communication technologies today. I spend an awful lot of time not on telephone calls. I spend an awful lot of time in WhatsApp chats, using Facebook video and Facebook Messenger. Sometimes it's private messages or even public messages on a social media platform like LinkedIn, which is exactly how Sam and I connected originally to pull this whole toolkit together. It was a post that Sam made and I commented on that post. And that is a very normal mechanism for communication now. And it's unlike this image that we're looking at on the screen here. It's not just some landline telephone. In fact, in my life, as an adult, I've never had a landline telephone. I've always just had a cell phone number, and that's a very normal idea at this point. So I just wanted to highlight the notion that video calling is normal. It is such a common thing, and I argue all day long that young people, maybe they're 3 or 4 years old today, they're going to be thinking about looking at the telephone screen, not holding a telephone up to their ear. That's sort of a thing of the past as we move forward in communication. We're not really going to have these phones that only had audio. For the children of today, I'm talking about 20 years down the road, they're going to say to us, it was really weird when you didn't see the other person at the other end of the call. That's normal for lots of people today. When it's a mass idea, that's what I'm talking about right now. And this image here that I have is me after a day of ruthless backcountry hiking in the mountains in Aspen, Colorado. And I managed to pick up a few bars of cellular reception, and I had a crystal clear video call with my wife in Halton Hills using Google Duo. And I bring up Google Duo because I just wanted to point out there's all sorts of video conferencing options. We don't just have to conform to one particular tool. What we need to do is we need to find the one that's going to be the best and the one that creates the most value and the most ease of use for my purposes, whatever my scenario might be, because I know that each community is going to be different. So we might just have to use different solutions depending on what you have available. And again, being open to that idea is going to be pretty important. So the point of today, as Sam was talking about, it's to help everybody navigate technology so that they can enable video calling throughout their community using the toolkit that we've already pulled together. Because what, in a nutshell, we've deemed it is an organized method for setting up video calls between residents and their loved ones during the COVID-19 crisis. I know Sam's already done it, but I want to tip my hat to the partners on this project. It's really been phenomenal working with Family Councils Ontario and the Ontario Association for Resident Councils. It's been a real pleasure to work with such great folks. So thanks everybody. I don't know what else to say about that. So our webinar overview for the day, I want to talk a little bit about some considerations regarding technology that have become average, common, basic things that Tech Coaches talks about with hundreds of people every year in all different sorts of platforms that we're teaching technology. Then I wanted to talk specifically about what the toolkit is identifying. I wanted to talk about the projected requirements and the barriers that we anticipate you could encounter. I want to talk about what success stories have already exemplified to us is working, and what some of these promising implementation practices could be that we could all be using based on what's already been successful. And then finally, I wanted to talk about scheduling, which is probably one of the hardest parts of the whole thing, because there's lots of humans involved with scheduling. I quite often say it's the human that's the hard part to crack with technology. It's not really the technology, because technology is getting easier and easier as we go forward. And sometimes you're having to unlearn as a human so that you can take on that easy to use or pretty simple anyways to use technology. So let's talk about the scheduling a little bit as well, because that can be a barrier to entry. And then finally, we'll conclude with a little bit of a Q&A. I'd really love to steer it towards the toolkit itself, but we're very open to any sort of tech question that you're going to have, as long as it's about trying to get these video calls going today. I also will say this now, but I'll echo it later at the end of the presentation. We are going to be doing sort of a tech support Q&A focused event next week, so I'll be able to share those details later as we go through this. So, a handful of considerations about technology to get the morning started. I have argued this for a really long time, and I think now what we all can see is very obvious in front of us. The road towards our future is rich with more technology in it. We are not finished developing the tools that we are currently using. There are going to be many more iPhone models. There are going to be many more iPad, tablet technologies. There are going to be, maybe we'll get rid of desktop computers, but at the same time, we'll increase the number of laptop computers that we're using so that we can stay mobile and move around a lot more conveniently, not only because we need to for work at this point, working from home, but also you can take mobile technology to somebody and ask them something about it, which I always like about mobile technology. I don't have to convince somebody to come over to fix it for me, as an example. So I like to keep my eye on this. I'm always going to using the new technologies. They're coming. There's not much I can do to get away from that. I'm going to have to enable myself. It's going to be up to me to learn about that technology. As I say all that, what we all admit to ourselves is technology is then going to be changing. The iPhone of 2022 is not the same iPhone from the year 2020. And just because you like the way that Windows 10 is today does not mean at all that Windows 10 is going to be like it is in the future of 2021. You don't get to keep the technology as it was. It's going to continue to develop and evolve, and that change is part of technology, so you should really always be anticipating that that's going to happen. Here's an example of that just from the toolkit development. We made a Zoom tutorial in print so that people could follow some directions on how to install it and how to use it in a basic way. And within a week, they added several new things which required a complete revamp of the tool overnight. And we just have to admit that that could happen any day, anytime. That's what technology does. So I feel comfortable with technology, anticipating that change. And I recommend that you also anticipate that change. Also with technology, I'm constantly anticipating there's this room for error. We as humans are incapable of creating something that is perfect. And because we made the technology, they are not perfect, which means sometimes it fails. Sometimes an app's not doing what you want it to do. Sometimes the internet is acting funny. Sometimes you need to know some basic troubleshooting to get the problem solved. And that's our individual responsibilities to come up with the skills that are going to be needed to do that basic troubleshooting. Because again, I say, like change, failure is definitely going to be part of technology. I'm not sure how many people have very young children in their lives, maybe 3 or 4 years old. But what I think you'll notice constantly is if you give exposure to a young child, just exposure to how a device works, one of these basic devices that we're using these days, monkey see, monkey do allows them to figure it out over time. I really believe that just about anybody with a willingness to learn technology can do it. It's all pretty easy. You don't teach a 3-year-old how to use a tablet. You simply just use it in front of them and they can pick it up. And I'm going to argue that all of us on the call, we're all educated adults. And now I'm going to take a little bit of time to talk about technology, and I'm going to talk about doing things with technology that maybe you've not done before. But what I'm going to say is if you want to do it, you can definitely do it because it's not too hard. You just have to do a little bit of that learning. And tech coaches, we're very, very happy to help you push through that. That's our specialty and our pleasure. So please let us do that as we go through this. Let's talk about what the toolkit says. Now that I sort of set the framework for where my head's at, where tech coaches sort of represents ourselves from, let's talk specifically about what the toolkit contains, because we think we know based on our own experiences running sessions for seniors, but also speaking directly to being successful right now since COVID-19 happened. What requirements did they need to have to succeed, and what barriers were constantly popping up? Number one, we know you need these 4 things. You need reliable Wi-Fi internet. What I mean by reliable Wi-Fi internet is not the same as the existence of Wi-Fi internet. The existence of Wi-Fi internet does not mean that it's reliable. I have been in many, many, many long-term care and retirement communities across the GTA. The Tech Coaches team runs regular recreational programming in about a dozen different communities, long-term care and retirement of all different brands. And what is deemed an internet connection across the board is very different depending on what community you're in. Some places have Wi-Fi that resembles what you would experience at the library, which means it works all over the place pretty well for a bunch of people all at the same time. Then you've got other scenarios where the Wi-Fi is only available in a very small area, and if too many people are using it at once, it hardly even works at all. So what I'm talking about here, what you're going to need is you're going to need that internet that's going to work all the time, not the one that everybody constantly talks about how it doesn't work and I can't make it do X, Y, Z. That's not reliable Wi-Fi. In the toolkit, we did point at the fact that it's been deemed an essential service. You know, it's like a human right to have internet connectivity in North America at this point. I'm pretty sure it's the UN that said that. It's very important. It's just like normal communication infrastructure now. So if this is a step to have your community upgrade that system, now's the time to do it. It's never been more relevant. It's never been more important. The second thing you're going to need is a functioning device of some sort. What I mean by functioning device is one that you have the adequate passwords so that you're able to install things on it properly, and it doesn't give you problems with the audio sometimes not working, or perhaps the screen is cracked and you're seeing everybody's face through a big crack in the screen. All of these to me aren't functioning devices. What you need is something that's going to have a pretty clear video call consistently as you help different residents connect with their families and their loved ones. A functioning device is going to be required. A finicky device is going to create annoyance, frustration, anxiety. And you all know this. On the call as technology users, when the device is not functioning right, it doesn't make you feel good. So we really need to focus on having devices that are capable of doing what it is we want to do with them, which is video calling specifically. We also recognize that there's two areas we're going to need help with human resources. We're going to need to schedule video calls with residents and their loved ones, and we're going to need to porter residents and operate the devices when the actual video calls are happening. And there's two ways you can do this. You can do this with the team that's already within your community, or you could use the help of volunteers. You do have the ability to recruit volunteers. Sometimes, you know, it doesn't seem like that's going to be an easy thing to do, but if that's the answer for your problem, then you're going to have to make the time to find that volunteer that then creates this opportunity for the community. It is an important priority, and we do understand that resources are thin, so it's just trying to prioritize those resources as well as we can. And what we would argue with regards to this toolkit being so essential right now is these volunteers, if that's who's needed, they really need to be figured out. They really need to be sourced. Now, there's a number of different barriers that can pop up. First one that people talk about is, but we don't have any devices available. We understand that devices are not necessarily cheap. That doesn't make the problem go away. So what we need to do is we need to come up with a solution to where do we get a device? Can you realign your recreation budget because you're not putting on programs that you would have normally put on to then buy an iPad? Can you start to ask every single resident's family to donate an old functioning device? Remember, you don't want their old devices that they don't even know if it works and they can't remember the passwords to log out of their own accounts. Excuse me. What you need is a functioning device that's, for the better part, all the way back to factory resets, so that you're almost starting with it at a new state. But you want to ask everybody if they have that device. That might require a volunteer's help to reach out to everybody. We definitely understand that. You're going to need to do this little bit of work to find these solutions. There's no way we can skip doing that work. So I do recommend asking people for help. There's no need to restrict it to only the family council members. You should reach out to the entire residents' family roster across the board. Also, does your team know that you're looking for devices? Is this just something that your recreation team is talking about and only 5 people know about it, but really there's 50 people in your community that should know about it because they might have an older iPad that they don't need anymore, or at a minimum, maybe they could lend that older iPad to the community for a little while just until a better solution is figured out. The bottom line is we have to be resourceful, we have to be creative, we have to do things that we haven't necessarily even done before. That's gonna be a little bit of our new normal, as Sam was suggesting earlier on, that idea of a new normal. It's gonna be a little bit more new, across the board, and talking to our families and asking for support in new ways is definitely going to be part of that change. Another barrier to entry is reliable Wi-Fi internet. Now, one very easy, if it's the problem, a very easy way to fix an internet connectivity issue if it's too slow, can you just call the internet service provider and upgrade the bandwidth and the connection speed? Does your community even have enough internet to try and do what it's doing right now? You might want to just call Rogers or Cogeco or Bell or whoever else you might be using as the internet service provider for your building and ask them if there's a speed upgrade that you could do that they think would fix your video connectivity issues. If that's not the problem, maybe it's a limiting factor that you only have Wi-Fi available on the main floor of your building in a library type room, and upstairs where all the people live, you don't have Wi-Fi available. How do you fix that problem? The first solution I suggested, it won't fix that problem, but maybe the second solution would fix that problem, which is get a smartphone that's paid for by your organization and use that to make a hotspot that could then enable other Wi-Fi devices to connect to it. Not only that, but you could use the device itself, having a data plan on it, to facilitate video calls. So I know maybe this phone is a brand new device that needs to be brought into the community, or perhaps it's already in there and one of your executive team has it in their pocket. And we just have to start thinking about a different way of using a resource that's already there to now enable something that we really want to be able to do. And it would be very easy for a cell phone with a data plan paid for by your organization that's already being used by a manager in your building for a 2-hour window every day to be designated as a Wi-Fi hotspot so that you can make these calls happen. I think that's doable. It would just require some conversations and a little bit of doing something resourceful, creative, you know what I mean, new. Also, something else you could do is you could reach out and ask for help again, asking all the families, not just family council, all the families for all the residents, would they be able to support the purchase of a wireless hub? If everybody chipped in a few dollars every month, could we get a Rocket Hub or some sort of Wi-Fi technology that would allow us to have a mobile Wi-Fi hotspot that we can take to the various rooms in the community to then enable video calls? That would be a very easy solution. It's actually very close to Tech Coaches. That's what we use when we visit various communities throughout the GTA. We have a backpack full of iPads, a couple of laptops, and a hotspot Wi-Fi hub. And we just turn that on and it gives us enough internet to power all of our gadgets for a temporary session when we're visiting with people. So I know it works well. You just need to ask people if they can support you to get it done. We already spoke about this in a couple of different ways, but people are talking about they don't have helpers. They don't have the human resources to take on any more tasks. Again, I say, is this a small team issue? And if you ask your big team in the whole community, would actually somebody else in a different division, maybe in the accounting area, they would have some time to help with this. If you don't ask people, if you don't let them know, then they don't necessarily know what they don't know. They don't know you want help. They don't know you're trying to do this. So put it out there to the whole team. Let them know that you're looking for donations of time so that they can, from their desk, just call the family members and schedule the calls. You know, we're not asking all volunteers to do the same thing. Some volunteers could actually do all of their volunteering from home if you organized it a certain way, because it would be a spreadsheet of phone numbers. They would call the people on that spreadsheet and then record when those folks wanted to have the video call. And that spreadsheet could easily be emailed to somebody that's now back in the community. All of this is doable, but I realize we have to get some things in place before we can start to do it. So don't be shy to reach out and try and get some volunteers to get involved with this. I've had in the nonprofit sector for many years great success working with community organizations that specifically help organize volunteers. One that comes to mind is Volunteer MBC. Community Development Halton is another one that I've worked with before, and there are equivalent organizations all over the province that specialize in pulling together groups of volunteers and then aligning them with opportunities to put their time in to help folks. So don't be shy to reach out to that sort of an organization in this time of crisis to ask for help. I know that they want to help. Let's talk about the promising practices that have already been working in some of the initiatives that we've been learning from as we built this toolkit. By the way, I'm just going to point at my screen here. You'll see this Netgear box at the top of the screen. That is a Rocket Hub. You would turn that little box on, and now that creates Wi-Fi for your iPad and your iPhone and your Android tablet and your Mac laptop and your Windows 10 laptop. Every device would use that Netgear box the same as it would use any Wi-Fi network that you've ever used before. So it's really handy to have that sort of thing. Ballpark, it costs about $100 a month to get that device, and that's about maybe 2 gigs of data every month. That's not a lot of data. So it does give a little bit of a price. That's why I'm saying you have to ask for assistance. You might have to reach out to the families to solve that. So on that conversation of the devices, what we're recommending is desktop computers aren't a solution. So you shouldn't really be thinking about a desktop computer. And the reason why I say that is it's just much too limiting. You can't move it. You must bring everybody to that desktop computer. And it becomes a very big problem when people are no longer freely able to move around the community, and now they cannot access that desktop computer. So what we would lean towards is a laptop computer, some sort of a smartphone, some sort of a tablet. Doesn't matter what brand. We don't advocate for anything in particular. What we do advocate for is a device with enough power and enough quality to actually create a good video call experience. Because if people are having poor video call experiences because they're using very cheap, old, donated devices, the value doesn't seem to be as high. There's still value, but it's not as high as if you had a donated, old, high quality device. So what I'm saying is just note that if you were to buy a brand new tablet, I would buy one for video conferencing much less than $200 price point. So that would mean to me that if I was given a 2-year, 3-year-old device that was still worth about $200, that might not be a very good device for facilitating modern video calls. It's a little bit cheap and it's a little bit old, so it might not work out. Whereas if it were an expensive older device like an iPad, let's just throw out the expensive one, then that way, you know you have the quality device back then that it can still sort of keep up. So I just like to throw that rule of thumb out. If you are looking for a new device, maybe you're in that $200 price range for a Samsung tablet or some sort of Android tablet, that would really get you right into it. Then you're going to need an app. And there's a number of different platforms that you could use to facilitate video calls. We have been putting together tutorials at Tech Coaches that are going to help people in print. So if you needed step 1, step 2, step 3 outlined for you, we've done all of that. Family Council Ontario has those downloadable PDFs on their website on a blog. So does Ontario Association for Retirement Councils, as does Tech Coaches. So we're doing our very best to pass these materials around. We've made tools for FaceTime, which lots of people have been using, especially if you're an iPad-based community, because other users that were on iPads as well, that's a very easily used app for that sort of iPad to iPad relationship. I have been reading online that there's now an Android version of the FaceTime app, which means now you're going to be able to use FaceTime on your Samsung tablet, which you weren't able to do before. So I think that that's something that we're going to have to be considering as we move forward as well. Again, remember, it's changing. It doesn't matter that it used to be one way. Now FaceTime that used to be only for Apple could be for anybody that wants to download it onto whatever brand of device they have, which is a good thing, right? Change is a good thing. So be ready for it and open. Zoom is what we started everything with. I know that there's lots of talk about Zoom in the media. What I've found is that it has been great for our purposes for doing one-to-one, one-on-three, or even a group of 8 people that want to have a conversation about something. If I was working for a multi-billion-dollar corporation, making arrangements for my Fortune 500 company strategically, maybe I'm not going to use Zoom because of what the media is talking about. But for us, everybody, for us, this is a great tool, and it's super easy to implement for folks that don't have it already, or they're less inclined with technology, because it doesn't require much new from them. It simply requires them to have already had email. If they had email, then you as the community could reach out to them and have them start up a Zoom call with the family member living in your building. Very, very easily done. The other tool that we're having great success with is Skype. Tried, tested, and true old school Skype. Although people haven't been talking about it, it never went anywhere. It's better than it's ever been. I would also recommend that one, but there's a little bit of limitation. Everybody's got to have a Skype account. So you're going to have to set up a Skype account for your community. You'll have to make sure that the family member also has a Skype account. You'll have to share that information. I understand that's going to require some coordination. That's going to need some administrative human doing. Maybe you need a volunteer to do that. I totally understand that. We understand that as a barrier, but we'll have to overcome that barrier. There's no other choice in the matter. So let's figure that out. How can we get humans to help us with this? Volunteers, that's how. We put together an implementation schedule because we wanted to make sure we provided as much guidance as to how to roll out an experimental video calling initiative. We were assuming that people were not necessarily going to be comfortable with the technology that they were using. It was going to be new. They weren't going to be understanding where their devices were going to work best, and they were going to have to figure out the scenario within their community that was going to be most accommodating to what they currently had. So there was a lot of moving parts that we were trying to take into account when we built this schedule. What we recommend is you could use it or you could not. You could accelerate it tenfold, or you could just full on start to do one a day and do exactly as the schedule says. Both would be just fine. Do what you think is going to work for your community. What we wanted to point out and why we built the schedule is because we wanted to point out these 3 ideas on the right side here. Staying on schedule can be a challenge. The moment that a call goes 10 minutes longer, if you didn't take that into account, now all the calls for the rest of the day are starting to fall behind, and before you know it, you could have to bump a call completely off the day because you've fallen off schedule. So staying on schedule can definitely be a challenge. One of the things that feeds that challenge the most is helping residents move around and then setting up the device. So if you have to take somebody from the 9th floor to the 1st floor and then take them down a corridor and then get the room set up and get the device set up, that takes way more time than just taking the iPad and the Rocket Hub, or taking the iPad and employing the Wi-Fi that's available through the whole building, just like it would be at a university campus, right? Everywhere in the university, the Wi-Fi works great for everybody. And that's what it should be like in your community. That would be a normal way of interacting with the internet. If I can take that technology to the person in their room and have them do this call in the doorway, that takes so much less time, and it allows you to stay way more in control of your schedule. It's having to porter people around and accommodating to all of the different variables that now play into that scenario that helps this schedule just completely fall to the wayside, and we don't want to let that happen. So our argument, hands down, is Wi-Fi available everywhere in the community is way better, way better. I didn't write way better. I just wrote it's better. It's way better than only in one room. In one room, in one area, much too restricting. I would just like to ask everybody on the call, would it be okay with you if you had to go to the living room to use your Wi-Fi at home? You have to. You have no choice. It doesn't work in the basement. It doesn't work in your bedroom. It works nowhere else, just in the living room. You wouldn't be okay with that because that's not a normal way of thinking about the internet anymore. Folks, that is the bulk of the toolkit. Today, we did not want to get too deep into anything outside of what the toolkit was trying to explain to you. We wanted to make an audio video version of the toolkit so you didn't necessarily have to read all of those words that we wrote down. What we did want to offer is a couple more things to support you, and if it's required, if the community is looking for it, we'd like to provide this sort of thing ongoing as we continue to deal with this crisis. So a couple of things to put on your radar screen. Next week, we have a tech support specific webinar. So it's going to be a Q&A with myself, with my colleague Melinda, with Sam, with Dee, with a few other people that we're going to pull together that are well in tune with technology and would have a pretty good opinion about what could be going on. And we want to help support whatever problems you're having with technology trying to do video calls. I do want to point you right at that. We can't unfortunately have a call that's now going to figure out how to synchronize your iPhone to your iPad and to your iMac. That's not the call that we're going to have. We're going to be talking to people about why can't I get Zoom to work on this Android tablet? And then we're going to talk about that as best we can in a webinar style format. We don't know 100% how that goes, everybody. So if you are interested in participating, please bring your patience. I will require some of it, if not all of it, on that day, but I do encourage you to participate in the bulk of that event because hearing what other people are going through is sometimes just as valuable as the prepared information or the answer in particular that you were looking for, because you don't know what you don't know, and hearing other people's conversations about technology is a great way to get yourself informed about it. It's an equally great way of keeping your finger on the pulse, sort of what the buzz is that people are talking about. And then finally, I wanted to say that we are having talks about the notion of an ongoing WhatsApp group. So we know that if we're doing a webinar answering questions, that happens on April 22nd from 2 until 3. But what about on April 23rd from 3 until 4 when you actually are experiencing a problem with your device? We wanted to create some sort of a mechanism where people could at least put a question out there to the ether with hopes that they're going to get a reply very soon. And we're trying to build what's called a WhatsApp group. For those of you that are familiar with it, WhatsApp is a very popular instant messaging tool. It allows us to create sort of like a members only group where everybody together can see all of the same conversation that's going on. So we would build that private group with all of us, and then we would be able to just pass our questions and our answers back and forth. And maybe that can actually facilitate some peer mentoring because you know the answer to the question that that person across the province is asking. No need to wait for Chris from Tech Coaches to write an answer. That might take him 20 minutes to get to it. If you're looking at it right now and you know the answer, then maybe as their peer across the province, you answer the question. That would be a great mechanism. We see a lot of value in it. We're trying to gauge if you would, or if other communities that are not on this call today, if they would find value in something like that. So please do anticipate, I guess, answering that question at some point in some way, shape, or form. I don't really know how we're going to figure that out, but we will. I assure you we will. So these are the two things that I just wanted to make sure you had on your radar screen that we have as our planned next steps. With all that said, folks, I have no more information about the toolkit today. What I have is a slide that asks if you have any questions. So I think now would be a good time. Maybe if Sam wanted to come online and if we were going to try and tackle any questions that pop up in the chat, super happy to do that.
Great, thank you so much, Chris. So as Chris said, now is the time to ask questions about anything that you've heard so far today about the toolkit, implementation, common barriers, or solutions. So I've got a couple from the chat box. The first is, just get your name, from Narinder, who's saying that at his or her father's nursing home, it's difficult to get cell phone coverage, let alone internet. And pointing out what it's very true that the desire has to be there by the home to work on the limitation. And is there any way family councils can leverage support? I think that it is absolutely possible for family councils to leverage support. What I've said for years is one of the beautiful aspects of a family council is coming together with your different ideas and solutions. So my advice would be get in touch with your fellow family or family council members, talk about what you've heard here today, and then see if maybe people would be willing to pitch in to support the purchase of a hotspot device. And then if so, propose that to the home, that this is something that council and families believe in and want to make happen. And in addition, just tell the home how much this will mean to you and how it'll improve the experience and the quality of life for families and residents. And talk about how one of the other issues right now is not just the COVID-19 experience, but the result of that loneliness and isolation that residents might be feeling because of not being able to see their families, and how you as a group can support making things better. So I think that council absolutely can do that. And Narinda's also following up that a WhatsApp group is a great idea. So I think we've got some enthusiastic and positive feedback there. And we do have home staff and council members signed in today to the session. So that is something that's, thank you for sharing, promising, and we'll be following up. Chris, this is a question that you might be able to answer best. How would homes go about disinfecting shared devices?
The easy answer is the normal disinfecting wipe that you've been using for anything. That is safe to use on an iPad screen, on a tablet screen, on a laptop screen. Apple has come out on the internet and said it. Samsung came out online and said it. So everybody was asking that question. It is a good question because sometimes on older technologies, especially, you are not to use certain cleaners on the screens because they are touch sensitive and that can wear off whatever coating they've put on the glass. But I can assure you, just using your standard protocol disinfecting wipe, whether that be like a Lysol wipe or I don't know the other major brands, but nothing out of the ordinary. I would not spray anything like Windex. That is not the same thing. Windex is glass cleaner. That is not a disinfecting wipe, so avoid Windex.
Great. Just to follow up, I've seen in public health infection control documents that is Chris's advice there is echoed there, that to use standard disinfecting and infection control protocols for any devices that it is appropriate. So that's another important consideration. Let's see. Sharon Cook, who is a resident, was wondering if there's companies out there that donate technology for students and seniors. So I'm going to, Chris, you can jump in a sec. But Sharon, this is something that we're actually exploring right now as a group with some of our colleagues at other organizations, is how to facilitate devices getting into long-term care and other communities to enable people to stay in touch. Chris, did you have anything you wanted to add to that?
No, I think that's, besides the human factor, the acquiring of the device is the other major barrier to entry. And I think that the path of least resistance to me has always been, and I've always recommended to seniors that were interested in technology themselves, was, did you tell your family that you were? because if you did, they may not have acted with the assumption that you weren't interested in technology, which gets thrown to an aging population so often. My whole professional life, I've been told seniors don't want or need or see value in technology, and it couldn't be more backwards. And if you just ask the family, there's a good chance they'll get on board with it. But they were assuming, and I hate to say it, but like our industry that we're talking to today, we were assuming, we didn't give credit to seniors for actually wanting technology. We were kind of deciding like, no, there's no computers here, so that means they don't want it. So I think ask away. Nothing bad will happen if you just ask for help in this regards.
Yeah, and to echo that, use your family council, connect with them to see how they would be able to support, whether it's, pitching together for a donation of a device or seeing what they may have at home. And also, your families may have connections through their personal and professional lives that they can leverage to bring technology into the home. So we are exploring corporate sponsorships and donations, but use your community, use your families, ask your family council. Right now, I think families are looking for ways to support each other and their loved ones. So please do ask them. And for the families on the phone, families and family council members, think about how you can make this happen to stay in touch with your loved one right now.
Sam, if I can just add as well, everybody, I just like the focal point to be on the community, all the people, and when somebody's donating an iPad, they're helping all the people, not just their family member that they love in there. They're actually helping a collective that they're all neighbors together and they're all in this together. And just by helping indirectly, that one loved one, you're actually helping the whole building of people by creating that opportunity. And it's, if you sell it like that, when you ask for devices, it sounds different. And that's why I bring it up, because sometimes people don't like to ask. And I want to assure you that it's not wrong to ask for this in a powerful way.
Yep, absolutely. There is so much potential right now through this crisis to come together as communities and to lean on each other, because the only way we'll get through it is together. So Chris's point, I think, is very well received. Robert's pointing out they use Zoom for Toastmasters groups of up to 100 people, which Zoom is definitely a great option. And, thinking about if there's potential also for using it for family council meetings is something that we're exploring, so stay tuned. Just to point out, the toolkit is available on the Family Councils Ontario website. If you go to our COVID-19 section, you'll see it there. Ontario Association of Residents Councils also has it posted, as well as tech coaches. So you can follow up with us by email if you can't locate it, but it is available on all of our platforms. And so also another comment about hospital, the infection protocol is using something called Cabicide now, not bleach. So you may want to ask your home about that. Sharon's pointing out an excellent idea. Perhaps Family Council and Residents Council could support this project as a collaboration with the home. I think that is a beautiful idea, Sharon, and I encourage all resident and family leaders who are listening in live or to the recording to consider how you can make this work in collaboration between your groups. This is something where you have a common goal to support the entire long-term care community, so your residents as well as your families. So I do encourage you strongly to follow Sharon's lead and to consider how family and residents councils could work together to make this happen. All right. We've got a few minutes left. I'm going to keep an eye on the chat box for any additional questions. But I do want to just take a moment to thank everyone for taking time on your Friday morning to be with us in person, and for those who are listening to the recording, to taking your time to do so. I believe that this is a tool that you'll be able to use to improve quality of life of the people who are living in your home, and also just the quality of the experience, the family experience as we're working through this as well. So thank you so much for your time and your interest in this. It will improve the experience of families and residents as we get through this. So I appreciate that very much. I'm going to leave, just another minute for any more questions to come in. If you do have questions that aren't perhaps quite directly connected to today's discussion, but you want to follow up with us, please do so. You can respond to the email you got confirming this session to get in touch with us, or you can send us an email at info@fco.ngo. So F as in family, C as in councils, O as in Ontario.ngo. And we'll be able to help you with family council related questions, support in navigating COVID-19, and for implementing digital virtual visits in your home. All right, Chris, in the meantime, do you have any last comments or thoughts that you'd like to share with the group?
Everybody, again, I really appreciate your willingness to be here today, because it says to us as well that we had the right idea, and we saw a challenge that was popping up, and we managed to get a little bit ahead of it, and the toolkit came out at the right time, and I just thank you for coming in today to get more information so that you can make this happen. And please pass along the toolkit to everybody that you think would find value in it, whether they're a community that's under the same organizational umbrella as you, or whether they're at a community that has nothing to do with your organization. That's not what we're talking about. What we're talking about is connecting people with their loved ones during probably the most stressful time that we've ever encountered. So I appreciate everybody's time today. Thanks very much, Sam. I wanted to echo what Denise wrote in the chat. She was thanking you for all of the work and all of the information that you've been sharing through the Family Council's Ontario platforms online, keeping everybody up to date with what's important right now. Couldn't do any of it without you. So thanks so much, everybody. Have a great day.
Thank you. And thank you to Chris and Melinda from Tech Coaches Canada, Dee and Josie Lee, and the rest of the Ontario Association of Residents Councils team. And on that note, we'll bring the session to the close and wish you a great rest of your day. And please take care of yourselves through this trying time and get in touch. And we'll see what we can do to help with this. Take care, everyone, and thank you.